Hey, what's going on, everybody? So Facebook won't let me go live anymore, so I'm just going to come and bring value to you guys this way. And so I've had a lot of followers. I've had a lot of questions lately come up. So I just want to give everybody kind of like a general overview of who I am, what I can help people with, and how I help people with it. So basically, my name is Dr. Strong. I'm a board certified chiropractic neurologist, certified functional medicine practitioner, practitioner of applied kinesiology. When I was younger, I was a super unhealthy child, got bullied, picked on, was overweight, had a lot of issues, and basically was able to turn my health around really fast in 4 months, and made me pursue a career in the health industry. And so I've decided that my mission is to educate and help as many people as I can go from being in the state that I was in, where it was very uneducated about my health and really struggling, just not even physically, but also mentally as well. So just had like a lot of fatigue, anxiety, depression, weight gain. And then I've kind of went more into like female hormones, helping with women with balancing their hormones with, any types of chronic weight gain, thyroid issues, estrogen dominance, PCOS. Just had really good success with at working and educating with women. So it's been great, and women, they get results really fast. So it's awesome. And then also GI issues. That's one that I'm going to touch on today. My training was I went to chiropractic school at Life University, and then I went to the Carrick Institute for Functional Neurology. Done training through Functional Medicine University, and also the Kalish Institute is one of my mentors and where I've learned a lot of this. So let's just go ahead and kind of dive in. A little bit more about my personal journey. Small town, had health issues, depressed, self-image issues, self-loathing, those sorts of things. Turned around, became a doctor, and now my mission is to help and educate as many people as possible and impact the world at a larger scale. And one of the reasons why I want to do this is because if I can help educate moms, dads, how to be healthy and how to make their kids healthy, then the kids won't go through what I went through. And that was just these feelings of depression and self-image issues and really struggling with my health for a long time. And so just that's kind of like the general overview of why I do this and why I want to help as many people as possible. So basically, I practice what's called functional medicine, and there are 3 levels to kind of how it works. So there's the root cause, there's your body systems that you correct, and then there's level 3, which is the symptoms. And most people are pretty aware of the symptoms. And that looks like, whether you're having heartburn, fatigue, it could be GI issues, whatever it may be. But, very few people are aware about the body systems that go along with that. So that looks like your neuroendocrine system, which is like your adrenals. This looks like your GI system. Everybody knows that one. And then also kind of like your brain health as well. And then we dive in further to say, what is the root cause of that's affecting like these body systems and then causing these symptoms. So the big 5 that I generally see are people are, overweight, they're fatigued, they're depressed, they have GI problems, and then especially with women, female hormonal imbalances. I see low T in guys, especially with their free test, causing a lot of issues with weight gain and those sorts of things. But to get to my point, all of these are related. So most of the time, if you have one, you're going to have the others. And they kind of are a subsequent effect of one cause, okay? And basically what this little presentation is about adrenal health. And so I'm just going to go really fast through this. So your adrenals, basically, let me go down here. So your adrenals secrete cortisol. They're also responsible for your sex hormones. A lot of your sex hormones, this is where people are having issues. A lot of the times people are low in DHEA. This is one of the first biomarkers that we run, like when we ship the lab to you. And then basically what we see abnormal levels of cortisol. And cortisol, if you look it up, if you look like autoimmune issues with cortisol, it's like increased weight around the hips and the thighs. It looks like chronic fatigue, striations, and brittle bones, osteoporosis, all these things. So chronic cortisol issues can lead to a lot of the chronic illnesses that you see today. And what this chart is kind of elaborating to is that it'll steal away from your sex hormones. So people that have estrogen issues or they have testosterone issues, what is happening is that you will actually bypass that pathway in order to make cortisol, because if you're super stressed out, if you have blood sugar issues, if you have chronic inflammation, or if you're fighting an infection, you'll secrete cortisol. And basically everybody is over secreting cortisol. Some people get to the point where they can't secrete cortisol because it's so burnt out. It's kind of like if you think about insulin resistance or type 2 diabetics, where the beta cells get burnt out in the pancreas. It's kind of that same factor. So the reason why I want to switch over to this one is because there is a lot of issues with gut. And I just had a female that I was working with that was suffering from hormonal acne, and she also had GI issues. And the interesting thing was that they were kind of one and both the same. So a lot of her GI problems were causing her hormonal acne problems. And there's a lot of studies about the GI brain connection going on. So the brain impacts the gut impacts the brain. So if you have like brain fog, chronic fatigue, if you have trouble getting up, if you're suffering with depression or anxiety, a lot of it could be coming from the microbiome in your gut. And that's what we found with her in her labs. She had what was called dysbiosis, which is an overgrowth of bacteria in your stomach that was affecting her neurotransmitter levels, because 90% of your serotonin, which is your happy hormone, is actually made in your gut. So I know I'm going really fast, but this is the Kalish Method. So we do lab testing, diet, and lifestyle coaching, and that's how we basically create health. But let me go to this. So this is just like a little funny thing, or I think it's funny, about how I was explaining, oh, well, if you work with me in 12 weeks, we take you from kind of sick, overweight, fat, fatigued, depressed, GI issues, or hormonal issues, and basically we correct those in 12 weeks. We have I have a 3-month program. It's basically 4 months by the time we get the lab results back, but yeah, so that's about how long it takes me to get people better. So now, one of the things that I found most important with working with people is that a lot of it comes down to not having personalized care. And that's what I do with my online business. Because I found that you need personal accountability, and you need more know-how, and you need to feel confident in your doctor that you're working with. Because a lot of the times the mainstream model has got to where it's just see as many patients as you can in a short amount of time, because that's the only way that you're ever going to pay off your student loans, which is really a sad factor when it comes to how our medical model is. But basically, what I have found is that if I work with patients more one-on-one and have more accountability with them, my results are almost 100% better. Because a lot of the times I find that people fall off, or they don't have the right mindset to kind of go through it. So you need somebody there to kind of make sure you're doing the right things, to kind of check on you, to answer questions, to understand where you're going. Because right now, this person who you are, whether you're overweight, oh my gosh, there we go. So that's supposed to be enough. Whether you're overweight, whether you've got fatigue, whether you've got hormonal issues, whether you've got hormonal acne, whether you've got GI issues, whatever it is, whatever you're dealing with, you have to understand is that this person right here that you are now is not the same as this person over here 12 weeks later. And that's what I found. I have to change who this person is in order to keep them healthy and make them healthy, because this person can't do it, or you would have already done it. Does that make sense? So one of the things that we work on is a little bit of your mindset and where you're going. Because one is you need goals. You need goals in order to kind of know where you're going and what the objective is. Because if you don't have goals, then you're going to really lose sight of where you want to go. And this could be like, oh, I just want to lose 10 pounds and I'll be super happy. Or does this look like I want to lose 70 pounds? Because your expectations and the protocols are going to look way different than if you're somebody who wants to lose 10 pounds or if you want to lose 70 pounds. It's also going to look a lot different if you're somebody who's suffering from hormonal acne and somebody who has PCOS. A lot of the things are similar, but there are things to kind of know and be aware of. And that's why I like this personalized treatment a lot better, because it helps keep you accountable and let you know where we're going and what realistic expectations are. So the problem is that your current belief systems are saying like, oh, well, it's fine if I cheat on my diet, or if I don't exercise, or if, I'm not doing stress relieving activities or those sorts of things. Because if you basically, let's just make this super easy. So if you're this person now and you want to be this person, like you're tired of being this person who's struggling all the time and you want to be this person who's thriving all the time, then whatever you would do as this person, do the opposite and you'll create this. But a lot of the times people have trouble doing that because they don't know how, or they feel like that's never going to work. So you need kind of the reassurance that that's how this works. And so with my case studies, with one of my patients had multiple sclerosis. She thought she was destined to be this way forever, didn't know how long she was going to live. And then we had been working together almost like 13 months, and she was 70 pounds down, no more headaches, no more chronic inflammation, and she was doing well. There was another multiple sclerosis patient I had, and she would fall all the time. And basically what we did was we just taught her an intuitive eating model, and we found out that dairy was actually causing her to fall down and causing her a chronic inflammatory response that attacked her nervous system that caused her to collapse. And then this recent one with hormonal acne, we found that her acne, because I teach an intuitive eating model, because we do elimination diet and those sorts of things, because diet is just so complicated, and intuitive eating is the easiest way to explain like what's going on and how to figure out what's causing your issues. But so here's the thing, like with this hormonal acne, it wasn't until 2 months in and we found out that starches and potatoes and rice were actually causing her an inflammatory response. And who would have thought? But you need that reassurance, and you need somebody to kind of there to work with you to say, hey, what have you done recently? How is it going? And what really makes sense? And the last thing that I'm going to leave you with is how to think like a doctor. Because if you can learn how to do this, you can solve a lot of your problems. And what you have to say is, and a lot of doctors don't do this, because here's how the system is set up. It is set up A plus B equals C, and that's not always right. So it's always like, oh, they have back pain, I adjust, back pain gone. Or it's like they have this autoimmune condition, and then you add in, well, what do? You give them, immune suppressing medications, that equals fixed problem. And that's not the case whatsoever. You have to really look and say, okay, what makes the most sense? And you have to say, when did this start happening? Why is it happening? And really look back at what you're doing, because most of the time you have to take responsibility that you're the reason that you ended up in this situation. And I know that that's kind of a hard pill to swallow, but it's kind of the reality of the fact. So if you're overweight, if you're fatigued, if you have GI issues, if you have whatever it is, the reality of the situation is that you probably didn't take action to learn about those things or find a good resource to learn about those things. And that's why you have those issues. And I know some people may get mad at that, but that is basically what I have to teach the people that I work with. And once they accept responsibility for that, and then they start taking actions and start working towards their goals, 100% of the time they get better. But it's until you kind of accept that responsibility and that fact that you'll probably still struggle. Now, I hope that you all have found this helpful and kind of explained a little bit more about, I wasn't able to post or go live today, or I would, but I hope this kind of helps explain a little bit more of what's going on. So I hope you guys really enjoyed this, and if you have any questions, please reach out. Please like and comment and share this to people that you think could help, because like I said, my mission is to help as many people as possible go through life without struggling with their health. So I hope this was enjoyable. I hope you all have a great weekend. Bye-bye.